respected chairpersons, and my friends. At the beginning, I must thank the organizing committee for inviting me to speak before you. So I was asked to talk on this particular subject, incidentally detected asymptomatic hepatitis B surface antigen positive subjects. So what to do? It is a real problem, and I have to start with a real patient. On 3rd of June 2015, 29-year-old male, non-diabetic, non-hypertensive, he went for a blood donation camp. And as usual, he was checked for hepatitis B and it is positive. So then starts everything. Whole problem, we have to take the history of jaundice in the past. It was negative. Family history of hepatitis B, hepatitis C, it was negative. History of any surgery, as usual, you have to ask, it is negative. No dental procedure was done on him. Commercial barber used frequently, no. Blood transfusion history, no. And even there was no sexual contact of this person. So definitely it is an incidentally detected hepatitis B surface antigen positive subject. So what is, by definition, what we say about it? This is the definition. An asymptomatic individual, when he is detected with hepatitis B surface antigen, and that's on a routine blood test or screening. So that is by definition. But once the person is picked up, the question starts, how it is picked up usually. So usually blood donors, as in this patient, and most of the time is a health checkup. The health checkup may be usually annual health checkup, sometimes pre-employment health checkup, pre-operative health checkup, visa checkup, or sometimes for antenatal checkup, or even nowadays anywhere in hospital before admission they used to check for Hep B, Hep C, or retrovirus. You have to check it. So point is, once somebody is diagnosed hepatitis B, it is a big issue. Big issue means there is distress of the patient or the family members because they think about the social stigma, they think about the cost of the whole therapy of hepatitis B. Then there is a question of the almost regular visit to the doctor. So all these issues come to the mind of the person. So it is a big psychological problem as well. So usually, whom to check for hepatitis B virus? Usually, this is the group, high risk group of patients, acute viral hepatitis, any chronic hepatitis patients, any family members, if somebody has got in a positive hepatitis B surface antigen or hepatocellular carcinoma, if we get, we have to check for Hep B. So basically, this is a spectrum of the disease. At one end, is a incidentally detected hepatitis B surface antigen positive person. At the other end, what we have got, it is the hepatocellular carcinoma or chronic liver disease. That's how actually whole spectrum liver around. But very fact we have to remember is almost 20 to 30% of this group of patients incidentally detected ultimately end up with the chronic liver disease or hepatocellular carcinoma and causing almost 650,000 of people dying annually all over the world from hepatitis B. And very interestingly, majority of these patients are unaware that they have got this virus in their body. So what happens in acute viral hepatitis? It comes to any person, hepatitis B. So mostly they recover. Sometimes it will go for acute viral hepatitis, fulminant hepatic failure, 1% of the patient, and few percent of the patient will go for chronic liver disease. So this chronic liver disease may be again if it continue to be for more than 6 months. So then they may sometimes have inactive or it may be an active one. If it is active one also, again it may be E negative or E positive group of patients. This is important. Why? I'll talk about it later on. So it is a fact today, if a person has got the virus coming to him at neonates or the childhood, it will continue go for the chronicity very high, almost 90%. But if somebody has got at adulthood the virus, only less than 10% will go for the chronic liver disease. That fact is very important for all of us. But once it is established that it is a just incidentally detected, we should not forget that it is asymptomatic, of course. That does not mean that it is absence of the disease. And that's why all these patients should be critically evaluated time to time so that we should know about the condition of the problem. This particular slide is very clearly showing that even in those patients, clinically normal, absolutely normal, and biochemically ALTS is also normal. But the histology will show that almost 50% of them may have some sort of microinflammatory changes in the liver. So that's why the evaluation is very important for all of these group of patients.